So you want to know where babies come from. When people have sexual intercourse, once the penis is in the vagina, the couple will kind of move back and forth so that the penis is rubbing back and forth. And during this time, sometimes it takes a long time, sometimes it takes a really short time. During this time, the couple will, hopefully it will feel good, and the man will ejaculate, which is when semen shoots out of the penis. And the semen is what holds all the sperm, which is the male sex cell. Meanwhile, the woman hopefully will have an orgasm, which is where her clitoris has been stimulated and she has this rush of pleasure. And after this happens, if the woman has been ovulating, you might remember from the menstruation video, if she's ovulating, an egg has been released from her ovaries, down her fallopian tube, into her uterus, then there's an egg ready to go. And all of the sperm and the semen that's now in her vagina is going to swim as fast as it can into her uterus, trying to get to that egg. And that sperm wants to get there quick. It doesn't have a super long life. And there are two kinds of sperm. There are egg sperm and Y sperm. All eggs are X's, which is a female sex cell. And sperms can be both. So they can be Y, which is male, or X, which is female. So if an X sperm makes it to the egg first, it'll break through the sheath, it'll get inside, and that's going to be a girl. If a Y sperm gets there first, it's going to be a boy baby. Once an egg has been fertilized, it's going to implant itself into the uterine wall, which typically that's what's being shed during your period. But since the person was ovulating, then that egg has been fertilized. And when that egg is fertilized, it's embedded in the uterine wall. It's going to start to grow, and it's called a zygote. And that zygote will start splitting into cells, and it'll split and split and split and split until it has enough cells to form an embryo. And an embryo is like the beginning of a human life. And it kind of looks like a little shrimp gummy bear. And that embryo is going to develop into a fetus. And by the time it's a fetus, it really starts to look like a baby. And you can look at ultrasounds and you can see how that baby is growing and developing. And it's moving and kicking. And sometimes they have fingernails and they suck their thumbs. And it's crazy, like how human they are in the womb. And these babies that are developing inside their mother's uterus, they're connected to the mother through their umbilical cord, which is the belly button. So from your belly button, there's a cord that connects to the placenta. And the placenta is inside the uterus, and it's full of blood and tissue and nutrition. So that it's pulling nutrition from the mother's body to feed the baby. And the baby's growing and developing and getting stronger every day. And after about 9 months, the woman will begin to feel what's called contractions, which kind of goes back to those period cramps, but they're much more intense. And contractions are important because that's the uterus squeezing the baby out. So when you see a pregnant belly, that woman did not eat a baby, she did not eat a watermelon seed, like she has a baby in her uterus. And a really healthy way to give birth is to for the baby to position itself upside down so the head is at the bottom, so it comes out head first. But that doesn't always happen. Sometimes the baby comes out feet first, and that's called breech, and it's a slightly more dangerous delivery, but we have a lot of technology and a lot of good medical professionals that can make that happen smoothly. But the baby will be in position, the uterus will squish and squish and squish, and that hurts, it's really painful, but there are drugs you can take in the hospital that make that less painful, and the uterus will contract until it pushes the baby down into the vagina, which is a muscle. So it's like a muscular tube, and it's stretching and stretching and stretching, and it can get up to 10 centimeters wide, which is big enough for a human head to go through. So the baby will come out head first, and when the baby comes out, it'll take a breath and it will cry, and it's still attached to the placenta. So the woman has to give birth to the placenta, and when the placenta comes out, all the blood and nutrition left in the placenta will go through the umbilical cord to the baby. And then sometimes the dad will cut the cord, or a family member will cut the cord, and they'll tie it up in this little bow kind of on the belly, and eventually that will dry up and fall off, and that's how you get a belly button. And once that baby is out of the woman's body, her body's already going to start contracting and bringing that uterus back to its normal size, and her body's going to heal, and she might have some blood continue to come out of her vagina for a few days, but that's just old blood from the pregnancy that she doesn't need. And her body's going to start making colostrum, and colostrum comes out through your breast, through your boobs, and it's what they call liquid gold. And liquid gold, it's a really wonderful nutrition that a baby can nurse on, and it'll keep them full and healthy and boost their immunity for several days. And when this happens, milk will come in, and when milk comes in, the baby is able to nurse, and the baby comes out having a lot of reflexes like being able to suck. So a baby can nurse, but not all women are able to produce milk, and that's okay. That happens plenty. And if that happens, there are a lot of supplements, and there are also women that donate their breast milk so that a baby can still have breast milk. So you can still feed your baby. It's not a problem. And that is how a baby comes into the world. There are a few details, though, that are interesting. Not all babies come from sexual intercourse. Some come from in vitro fertilization, which is when a doctor can take an egg from a woman and a sperm from a man and fertilize that egg and then implant the egg back in a woman's body. So sometimes people experience something called infertility, where they're unable to get pregnant for different reasons, or sometimes they're just not able to get pregnant because they don't have a partner, or their partner's not a man, so they'll use in vitro fertilization to have the baby. Another interesting thing that happens when an egg is fertilized, sometimes it will split into two, and that's how you get identical twins. And sometimes a woman's body will release two eggs and they'll both get fertilized, and that's how you get fraternal twins. So identical twins look exactly alike because the egg has split, it's the same egg, but fraternal twins, it's two different eggs. So that's why they don't look alike, but they were born at the same time. And it's the same idea with triplets. When a pregnancy ends suddenly and unintentionally, that is called a miscarriage. So if you ever hear that word, that's when a woman has lost a pregnancy that she wanted to have. And sometimes miscarriages can happen very early in the pregnancy, and the baby is so small it still looks like a cell. And sometimes it can happen really late in the pregnancy. And sometimes a woman could give birth to a baby that's died, and that's called a stillbirth. And these are really hard experiences for someone to go through, but that's called a miscarriage. When a pregnancy has been ended on purpose, that is called an abortion. And these are some words you've probably heard, and I just want you to know what they mean. So, as you now know what pregnancy is and where a baby comes from and how it comes out of your body, you now know it does not come out of your belly button. And you now know that a woman did not eat a baby. And most importantly, a woman does not poop a baby out. They come out of her vagina, and it's a really miraculous, amazing process. And it is painful. You may have heard that, and that's important also to know. But look at all the people that have gone through it and have survived, and this has been good. So if you want to know more about pregnancy, you could ask your parents what their thoughts are on pregnancy. What do they wish they knew about it as a kid? It might be fun to ask your parents, like, where did they think babies came from when they were kids? That would be a fun question to find out. So I hope that now you have a lot of clarity on where humans come from.